Pancreatic cancer is one of the 10 most common cancers in Australia, and so about 4,000 Australians every year are going to present with this disease. Only 10% of patients who present with pancreatic cancer will be alive at 5 years' time, and therefore this year we know that it'll be the third leading cause of cancer death, behind only lung and colorectal cancer. Unlike other cancers, there really have not been those same levels of improvement that we've seen in regards to treatment and outcomes, and therefore it's the third biggest cause of cancer death right now, but it's predicted to be the second biggest in only 10 years' time. And this is a stat that we need to really deal with and improve on urgently. There are a multitude of reasons of why pancreatic cancer is so lethal. We know that it's actually very, very difficult to diagnose.
Not many people understand what the pancreas does, where it is, what type of organ it is, and so there isn't that instant connection that, hey, I have back pain, my pancreas is back there, that might be a symptom of pancreatic cancer, or I'm jaundiced, that's linked to my pancreas.
GPs see thousands of patients and they might only see 2 or 3 pancreatic cancers a year. The presentations of pancreatic cancer with things like bloating and reflux and diarrhoea and weight loss is actually quite similar to a lot of the other things they see, like ulcers and heartburn and irritable bowel syndrome. So it's not surprising that for a busy GP, it's never at the front of their mind. It is also a very complex cancer. It has a strange biology, can present in different ways and can often have invaded outside of the pancreas and around the body even before symptoms occur. Unfortunately, due to all of these reasons, by the time that pancreatic cancer is diagnosed, we know that 80% are already not at an operative phase, and this is a tragedy that we really need to deal with. We've been able to see huge gains in other cancers, whether it's through screening programs, whether it's through early diagnosis, or whether it's through better treatment options, and we've been able to see a number of these cancers actually reduce in their mortality. Unfortunately, it's the opposite with pancreatic cancer. We've really made no gains.
Over the last 20 years, the survival rate has gone from 5-year survival rate of 3.2% up to now where it's 10.7% survival rate. We've seen how great the outcomes have changed for breast cancer over the last 2 decades. We see pink and we know that that's about breast cancer, and that's been reflected in the survival rate. It's gone from 72% up to above 90% over the last 2 decades. That's also been assisted with screening for breast cancer. And so it takes a lot of advocacy, it takes a lot of knowledge from the general public, it also takes a lot of buy-in from the government to really push that survival rate up. And I look at breast cancer as really the gold standard as to what we need to try to achieve for pancreatic cancer as well. We really need to emulate that, increase the conversation about pancreatic cancer, know that purple is the colour for pancreatic cancer, and get everyone on board so that we can really push that needle and move the survival rate up. To be that devastating but only receive 4% of the research funding, that's just something that I think more people need to realise and know that that's not how it has to be, and that we can change that and really improve the outcomes for patients.
Even taking something as simple as screening and bowel cancer screening, colleagues of mine 20 or 30 years ago started to set up studies on their own looking at things like fecal occult blood screening, and they were able to demonstrate in studies that it really made a difference. And it was eventually turned over to governments around the world, and we have demonstrated the mortality benefits that have happened to that. It's things like these that make me excited that even though we're 10 or 20 years behind cancer research and gains in some areas, that really being able to focus on these things will really make a difference as it has in other areas. It would be lovely to see if we can bring pancreatic cancer diagnosis and management up to where some of the success stories we see with other cancers as well.